Today, we are marking 2 years of our response to COVID-19, and we should all use it as a time to look back and reflect on the amazing achievements, and also take time to remember how difficult and challenging it has been at times. The commitment and dedication shown by teams across hospitals, community care, GPs and volunteering has been extraordinary. The Team Tayside ethos of working together to find new ways of providing care, delivering solutions and innovating, be it through new services or equipment or treatment, has shone through. It's been 2 years of constant change, but you've all responded with professionalism, care and compassion. And it's that determination to adapt and succeed that will see us through as we move towards the next phase of recovery.
For the past 2 years, we have all had a very challenging time, both at work and at home. We have done really well in NHS Tayside. We have managed to do a fantastic response delivering our emergency and cancer care despite these enormous challenges that we have had. As you know, throughout the COVID pandemic, we've had to redesign the hospital not once, not twice, but many times over as we respond to the challenges of the past 2 years. If I take you right back to the beginning, we had to create a hospital within a hospital to deal with the COVID patients. And also we had to upscale our critical care to 4 times normal capacity to deal with the surge of critical care patients that we had. But then, almost immediately after that, we had to think about our usual patients, our elective patients, and we created a green zone, which allowed us to start treating our patients as one of the first health boards in Scotland. At the end of the day, we only managed to do this because of the exemplary and extraordinary staff we have here in NHS Tayside.
2 years ago, under the rising threat of coronavirus, NHS Tayside opened 5 coronavirus assessment centres to ensure that patients could continue to access good clinical care during the pandemic. At that time, we had very few effective treatments for coronavirus. There was no vaccination, and we were facing an extremely infectious virus that caused a high incidence of serious harm in those who caught it. It was clear that a good system was needed to separate those who might have COVID from those who didn't. COVID assessment centres did that job extremely well, allowing both COVID care in the centres and general practice care in general practices. Over the following 2 years, coronavirus rates have changed. Effective vaccinations have been developed and new treatments have become available to treat those with COVID. The need for these centres has therefore reduced. Practices have designed new processes to separate those with infection from those without, with clear guidance that supports the safe care of those with coronavirus within the community. The centres in Angus and Perth closed in June 2020, and the Dundee Centre was integrated with the Nine Wells COVID Assessment Centre in February 22, after seeing many thousands of patients. The end of the COVID assessment centres does not mark the end of COVID. There is a continued need both in hours and out of hours to pay attention to infection control, to continue to offer immunisation and to identify and treat those most at risk of coronavirus.
Our public health team has been working to deliver the acute public health response to the pandemic. Test and Protect, who do all the contact tracing, providing individuals who have COVID and their contacts with advice and support. The Specialist Health Protection Function, who work with the higher risk settings such as care homes and lead and manage the response to outbreaks, and the vaccination teams, who have now delivered over 920,000 COVID vaccines since the pandemic began. But none of this could have been possible without your support also. Without you playing your part in following the guidance, getting vaccinated when offered the jab and supporting each other and us, we would not have been able to reduce the impact of the pandemic as we have done over these past 2 years. Thank you.